I'd start.
Okay, good morning, good afternoon, good evening, wherever you are. Welcome to PQMD's first event in our Global Health Policy series of regional roundtable discussions. I'm Elizabeth Ashbourne, and I'm the Executive Director of PQMD. This series is a brand new effort for PQMD and really special to us because we believe in underscoring the power of our partnership and the interconnectivity of the PQMD network. We have crafted 3 roundtables to highlight the rich interests and expertise of our PQMD family at a regional level. Today, our focus will be Latin, South, and Central America, and specifically the complex host of issues around IDPs, migration, refugees, and populations on the move. Migration in South and Central America is at an all-time high, and each panelist brings exceptional perspective and humility to the enormous and multifaceted tasks of caring for millions of refugees and migrants as they seek safety and security. For those of you who are new to PQMD, we are a global alliance of international NGOs and leading healthcare companies committed to advancing the role of product donations worldwide. Founded in 1999, our work is guided by 5 pillars: humanitarian assistance, health system strengthening, disaster response and preparedness, guidelines, and knowledge management. These roundtable events showcase the power of our partnership at a local level, and we would like for all PQMD members to always feel as if they are part of a larger extended family full of resources and like-minded people continually working for access to health. PQMD relies on the strength of our coalition and the work of our members, the work that our members do every day to inform our ongoing programming. So please visit our website and our community of practice for upcoming events, practical tools, and to be part of the larger conversation. We will drop these links into the chat box for your reference. And whether this is your first PQMD or your 50th, I want to welcome you and encourage you to warm up your fingers and put your name in the chat box and let us know who you are and the organization that you represent. And additionally, we request all participants remain muted during the main presentation, and feel free to add to the discussion in the chat box with questions and comments throughout. And we will also be using Slido as a way to engage the audience in a structured way. And so to participate in that, please use your camera or any smart device to scan the QR code or go to www.slido.com and enter the numbered code. And lastly, we are recording this session to post on our website, and we do have a really great group of people who do listen to these forums after the fact. So hopefully that will be helpful. And now it is my honor today to introduce Maria Cecilia Lopez, who is the Senior Public Health Officer for the Regional Bureau of the Americas with the United Nations Refugee Agency, UNHCR. A veteran to working on emergency projects and humanitarian response to the effects of war and natural disasters, Maria Cecilia has participated in the development of regional strategy, drafted global guidance in the Americas, and been a key part of the response efforts around the globe. She has experience in numerous conflict zones, including Darfur, Pakistan, South Sudan, and the Gaza Strip, and has participated in many specialized epidemic outbreak responses. And just to name a few, she has worked in COVID-19 in Spain, Ebola in Sierra Leone and the DRC, HIV/AIDS in South Africa, measles in South Sudan, yellow fever in Angola, cyclones in Mozambique and Nepal, as well as the earthquake in Ecuador. She is a medical doctor by training and clearly a global health expert practitioner. Maria Cecilia's deep understanding of the needs for both people on the move and the systems that must meet these needs while in the fog of war, natural disaster, and disease make her a perfect keynote speaker to kick off today's discussion. So with that, Maria Cecilia, I hand it over to you.
Thank you very much for this presentation. And thank you for having me here as a keynote speaker. On behalf of UNHCR, I am very honored to be participating and also with these experts of these panels of experts. Today, I think that is these opportunities to have to stop a little bit and to think about the work that we do and how can we improve is a great opportunity for all of us to to think how can we improve of work and as well our partnerships. So I'm very thankful for PQMD for this invitation. Today, I would like to talk a little bit about the Venezuelan situation, not because of the North and Central America situation is less important. It's just mainly because I will focus in the health needs and the health needs in Venezuelan population across the Americas had a great impact through the Venezuelan displacement. So we know that by the end of 2021, 6 million plus Venezuelans have been displaced abroad globally. We have about 5 million of those Venezuelans who are remaining in the Americas, distributed among 17 countries. But we know as well that 4 million plus Venezuelans are living in mainly in 4 countries. Those ones are Colombia, Peru, Ecuador, and Chile. So we know that this is a great burden for all those countries that are receiving these Venezuelans. We know as well that there's a complex situation in Venezuela with the access to essential health services are lacking with especially health services. And it is critical for the population that we are serving, as well as the COVID-19 that didn't help globally in terms of health response and again, overstretching the health personnel, the health facilities, and overwhelming as well all the capacities in the countries, not just only here in the region or in Venezuela, just it was global. I had the opportunity last year to visit some of the countries that they were recipient, most of the Venezuelan refugees and migrants, namely Colombia, Brazil, Ecuador, Peru. And I was shocked with what I have seen. I have seen so many unmet needs. So people who really were looking for a glass of water, clean water, for food, people without shoes, people walking along the street with barely any belongings, coming already for secondary movements, coming. I have seen those people in Peru already. A journey for probably 3-4 months inside the country in those conditions. So we have a lot of unmet needs in the region, but however, health and the access to health has been one of the main reasons why Venezuela has been displaced abroad. To share a little bit of my observations when I was in the field, by collecting some information from our staff that are the first responders in the field, that they are mainly with the offices in the borders, and also by conducting some of those participatory sorry, I got stuck. With this discussion, the group discussions, I have been, I would like to highlight 6 of the main gaps in public health in this region. I will name as a number 1 is the access to health. The access to health through the lack of access to information. Why I'm saying as the number 1, the people they are displacing from one country to another. We have secondary movements in the region that the people they don't get to understand how the health system works. They are new in a country. Many of them, they are lacking of documentation, and the information is key for them to access to the system. Although some of the countries, we may have some packages that they will be entitled to assist directly. However, they don't know how to do it. So this is one of the main key gaps that we needed to address. That is the access to information for the population that we serve. in terms of providing all the process, the guidance in how to access. Regularization is another big gap that we have. We are suffering the consequences of 2 years of pandemics where the borders were closed. However, we know that the people were still passing from one country to another through the trochas. So the regularization, we know that is imminent. We know that there are a lot of effort from many countries like Colombia, now Ecuador and Peru also, they are in that process. However, it will not happen overnight. And we need to accompany those governments in this process. We need to also to be alert and to monitor to what it will happen with all those people that it will not fall under the regularization. So regularization is one solution, but however, it's not happening as yet. The other gap that I have seen in the region is to address the consequences of the COVID-19. And here we have to address the consequence through the health, the impact that they have had in the health system. Let's see, infrastructure, lack of supply, the disruption of the supply chain, as well as the affectation of the personnel, the workforce at the hospital level, it has been dramatically. So we need to also support them. And of course, as well as the restoration of the social economic safety net for the population that we are serving. Another gap is to make sure that in all programs we have included the needs of the most vulnerable population. And here I want to just really make a clear that we need to have programs to serve to the LGBTIQ+ population, especially for trans women, for women with pregnant women, for girls and boys, as well as for adolescents. We have a big gap here that we are not addressing the adolescent needs. We see adolescents walking alone or with accompanying with other parents, with other adults, and we need to address those situations. Indigenous population as well. We have a great community and a big community of population, indigenous population moving as well in penal movement across the Venezuela, Brazil, and Peru, that it has to be cared for. People living with disabilities. We know as well that from Venezuela, many people have been living seeking for health services that are not available there. And among of those ones are those ones that are catering for people with disability. We're talking about mental, neurological disability, as well as physical disabilities. And of course, people living with HIV. Here is something that we need to really work across the region, not just only in the Latin Americas, but as well as in the Central America, to make sure that the people who are living with HIV have access to the treatment. We have a big problems, as many of you may know, in Colombia with the patents, with some of the drugs that are patented, and we can not buy those drugs with the high price that the patents are selling them for. Another gap that is really a key, that is the lack of reliable data in health access and utilization coverage for health, for migrants and for refugees in the area. We know that most of the services are provided by the Ministry of Health, and Ministry of Health, they don't have disaggregated data. So the data that they provide is not always reflecting the people that we serve. So it's very difficult to analyze and to advocate with that data, without the lack of data. And the last but not the least is the lack of long-term financing engagement that we have in the region. We know that we have, that this is New Africa, but we have a crisis. It's a crisis that it should be really looked at more. Already is a protected crisis, and I should be looking at more sustainable solutions. We need to have more long-term solutions in this case. And in terms of what are the key priorities in health that I have seen, I would like just to focus in five key areas that mainly is the restoration of continuity of care, especially for those chronic disease, the reproductive health, and in terms of sexual and reproductive health care, especially for adolescents, the supply of contraception, clinical management of rape, to other areas where I have been working. I have been surprised here that clinical management of rape is not available everywhere. And when we are talking about access to clinical management of rape, PEP kits in the areas of the borders where most of the people have been reported being affected, let's say the Darien, we can put as a name in the Darien, here in Panama. It's shocking to know that no, we don't have many people who have been trained to provide, and we don't have those kits available for the population. We needed to also, in terms of key health areas to prioritize, is the community health, community-based protection programs. Again, to link with one of those needs is to provide the access to information to the people that we are served, that we have the monitoring what's happening in the community. So we really need to work with the community health workers. We need to provide access to secondary and tertiary health care to the population, because we need to provide treatment for those who are coming, especially from Venezuela, seeking help, seeking treatment for cancer, seeking treatment for whatever disease that in Venezuela is a death sentence. And of course, mental health and psychosocial support is a great need in the region of providing mental health and psychosocial support for the people who have been affected. We know that they are in need of these services. We know that it's not provided by the Ministry of Health, as they don't have it as a normal package in the services. And sometimes, even if they have it, are not adequate to emergency situations that we are facing now. So in that case, we really need to work with NGOs who are specialized, who are providing the services, enhance the capacity of the government to really to respond and to integrate these alternatives. Well, as I am approaching to the end of the presentation, I want to just also to highlight, not everything's problems here, but also I would like to highlight some of the opportunities that we may have in the Americas. I guess that the regularization is a great opportunity. We can see here the opportunity to regularize and to include the migrants and refugees into the national health policies. We needed to provide the access, but at the same time we needed to have the inclusion into the big plans of the governments, all right? So we have here, one of the opportunities that we have here in the American is that we have a strong capacity from the government, and the government can respond to this. However, they really need help. We need our support as well to be able to face those needs. Health information system also to support it. In terms of working in partnership, I would like to just to again say engagement with development, cooperation, Ministry of Health. We need to work all the UN agencies together. We need to work with the international cooperation to look for more long-term solutions. financial institutions, private foundations, bilateral donors. Really, we need to also involve academia to have more evidence-based results in order to provide as well advocacy with the donors. And again, the last but not the least is that here in America we have a great and very strong civil society that we can count with. We need to help to promote the capacity to give it opportunities to continue really emphasizing in the power that they have here in the region and strengthen their knowledge. So this is mainly looking at the localization agenda that is strengthening the local capacity. And with that, I will just conclude.
Thank you. Thank you very, very much. That was very, very thought-provoking. So those were fascinating insights on the very many issues of medical security, access to information, data, the challenges of sustainable access to quality healthcare during the journey of migrants and refugees. I think you've given us a really terrific platform of information from which we can jump into our roundtable discussion. And we really greatly appreciate your time and remarks. And thank you for staying with us through the session. Maria Cecilia will stay with the workshop here and will join us again for the Q&A at the end. So again, thank you very much. I really appreciate the organization of your remarks, and I think we can really address many of those things or discuss many of those things in the roundtable to come. So now I have the pleasure of turning over to our moderator, Jody Allison from MAP International. She is the Senior Vice President of Global Giving and Innovation. And Jody is responsible for the leadership and management of the Global Giving team, securing donating medicines, health supplies, and cash gifts, as well as developing strategic and operating plans to achieve global commitments. She's also responsible for innovation and growth strategies to help MAP International significantly increase its impact around the world. We have been really lucky to have Jody as a member of our PQMD family for quite a long time, and we're thrilled to have her moderate this esteemed panel. Thank you, and over to you, Jody.
Thanks, EJ. I have been around for a while. I'm now kind of in the old school group of folks with Pat and some others, Randy, who have been part of PQMD for a really long time now, and it's been a pure pleasure. So thank you, EJ. I feel so honored and fortunate to be here today and to introduce you guys to our incredible panels. We have a lot of wonderful things waiting for you. Just a little summary of what we've been talking about and why we're here today. Migration is at a historically high level around the world. In Latin America alone, millions have been driven from their homes in the current complex landscape due to political instability, violence, extreme weather events, and pandemic-exacerbated economic and public health crises. So today, we're going to spotlight the work of regional PQMD-network experts who are tackling these complex issues. And we're going to discuss current migration dynamics, international responses, optimal service provisions, and collaborative opportunities with all of you guys to effectively respond to this complex humanitarian crisis. So we have a lot in front of us, right? Like that's a pretty long list, but we're getting there and we're going to do it. But before I introduce our esteemed panel, there's a few little housekeeping items. So first, I am only highlighting the name and the title of the panel members just due to time, but their full bios deserve a very close look by all of you. They are fascinating folks. So those are going to be in the chat section. Please check it out and make sure that you read their full bios. Secondly, have your phone ready. Put it right beside you because we're going to do a quick poll. It's not going to be long, but you're going to need this to make that poll happen. So Sam's showing it right now. So go ahead, get your phones ready. You can listen to me as I do the introductions, but it's important for this component of our work to make sure that you have your phone with you. And third, many of the questions that we're discussing here, our speakers are going to have just a few minutes, like a couple of minutes to answer. But these topics deserve a lot more discussion. So we want to keep that discussion up in the community of practice, the PQMD community of practice, the COP. So if you don't know what that is, or if you need to sign up, please just note that in the chat, because these topics are just so pertinent to what we're all doing, and they shouldn't stop after 4 minutes per speaker. We want to keep that going. So just make sure that you're noting in the chat section if you need any help with the COP, but that's really where we want you guys to keep up this discussion. So let's make sure that we do that. And then lastly, any questions that pop up that are mulling over in your head while our speakers are talking, whether they're for a panel member or Dr. Lopez, please add those to the chat. Victoria is going to monitor those for us. And I really want us to have a robust Q&A time at the end of our time together here. So please make sure that you're adding those questions. We really need your help with that. All right, I am going to introduce our panel, and I'm so privileged to do so. The first person that we have is Adib Fletcher. Wave to us, Adib. He is the Senior Director of Latin American and Humanitarian Response for Project Hope. So welcome, Adib. Next, we have Kendra Gregson. She is with UNICEF. She is the Child Protection Regional Advisor for Latin America and the Caribbean. And wave to us, Kendra, hello. Then with International Medical Corps Venezuela, we have Facundo Palermo. He is in information management and meal coordination for International Medical Corps. These are all, of course, PQMD members, including our next speaker from Johnson & Johnson. It's Reggie Sokol. She is the Latin American leader for global community impact. So welcome, panel. So happy to have you. And we're just going to cut quickly to our first poll. We really want to know more about you. Who is on the call with us, or this Zoom meeting with us today? So you're going to see these questions up. Thank you, Sam, for putting those up there. You can see here, what sector do you currently work in? If you have any issues with the Slido, just throw your answer in the chat maybe, just so we can make this as robust as possible. But it looks like we have a mix here between NGO and corporate. We got some corporate people still showcasing their numbers here. So welcome everyone from all sectors. It's good to know who we have on the call. And then we have a second question that Sam's going to show up here for us. What brought you here today? Are you already kind of familiar with this topic and interested in learning more, or do you work specifically in this space? Again, just kind of getting to know who we have in the audience, so it'll shape probably some of the responses from our panel members now that they know a little bit more about you. So thanks for participating. Oh, we're getting higher here in the work in the space. It's fun to see this, right? Like it's very interactive. I love it. All right, guys. So let's go ahead and take off the poll, and we'll head into our first question. Thanks, Sam, for doing that. Just a reminder before we go into questions that everyone should mute. Except for the speakers. If the speakers can go ahead and just make sure that you unmute, so we aren't having to constantly go back and forth. So our first question, which is a round robin question, everyone here is going to answer it. Facundo, I'm going to pass it off to you first. Here's the question. I know that you guys all work so closely in this space and with these issues. And so, of course, we're so excited to dig into all the interesting topics that we're going to cover. But I want to start first by almost kind of stepping backwards and ask, from where you sit and what you see on a daily basis, what is the one key takeaway that you want our audience, all of us, to walk away with today? Facundo?
Yeah, of course. Well, first of all, nice to meet you all. It's a pleasure to be here, surrounded with this wonderful panel. So what we see on the field is tremendous need, basically on every sector that you can imagine within humanitarian needs, support. infrastructure. We see enormous needs, which obviously are the main drivers for these big migration waves that we have been experiencing for years, and that for sure we'll cover during our panels. I think if there's only one key topic that should be resonating in your mind at the end of this conversation, is that this is not an isolated case. It's not that since Venezuela crisis started, migration is big on the region. This has happened for a really long time. There's a lot of people with tremendous needs, pretty much in every country in South America and in the LAC region. So definitely important to keep that in mind. This is a pressing need, this is an emergency, and we definitely need to work together to cover these enormous needs with pretty limited resources.
It's great. Thank you, Facundo. That's perfect. Kendra, if you can unmute and just let us know what your thoughts are. What's the one takeaway in just a minute or two that you feel like you want us to walk away with?
So again, thank you very much for inviting UNICEF to this panel, and great to meet my fellow panelists as well during this call. I'd say from UNICEF's perspective that the one takeaway is that regardless of whether the child is a migrant or a refugee, what country they're in, what status they have, children have rights. That means they should be able to access services such as healthcare and education. They should have an identity. They should not be violated. They should not be abused. They shouldn't be detained. They have rights. And therefore, to recognize those rights, we need to strengthen the national welfare systems so that we can make sure that those rights are delivered. So we need to have the legislation and policy in place so it doesn't discriminate against them. Of course, recognizing the sovereignty of the state. We need to make sure that those healthcare workers, those social workers, those border patrol officers, those schools, those health centers, they have the staff to deliver. And finally, it's also about the community. The community also helps in delivering those rights so they're not faced with xenophobia, that they are welcomed, they are okay. So that would be my key takeaway. I hope at the end of it that we realize that children, doesn't matter what nationality they have rights.
Oh, that's beautiful, Kendra. And we are going to dive into kind of these two very vulnerable populations, which are women and children related to this topic. So I love that just right off you're mentioning in such a strong way and in such a beautiful way to just continue to come back to children have rights and vulnerable populations have rights. And I think that we're going to cover that a lot. So I love that you're starting with that. Reggie, what do you think that we should walk away with today? And you may need to unmute.
Hello, everyone. Thank you, Judy. I was reflecting about our mission because we are guided with our mission to support and develop the frontline healthcare workers. And when we see the healthcare systems under so pressured by the high demand of those populations that are asking for services, are asking for support, and sometimes the centers that are offering healthcare services are the main contact between the communities between the communities and the society. We need to have healthcare workers and center of healthcare services prepared, technically prepared, and with enough resources to provide the services that those populations are asking for. And our colleagues say that the needs of the women, the needs of children and adolescents. So part of our experiences as well is taking care of the healthcare workers and taking care of the women and children, preparing the healthcare workers to address the needs of that. So the different scenario where those women and children are, it's totally different than other women. And sometimes they are coming from violence, they are coming from other stressful and different situations that are pressuring them. So we need to have professionals prepared technically, but also emotionally to take care of the needs of those populations.
Reggie, one thing that really struck me is we can kind of add these healthcare workers into the vulnerable populations too. They're coming off of a very weary couple of years with COVID and coming right into this other crisis that we're dealing with. Of course, those segue with each other also, but these are people who are mentally and physically worn down, and they are now treating people in big droves who are also physically and mentally worn down. So I think you being a spokesperson for the healthcare workers is really going to benefit us today, because that's a voice that needs to be heard loud and clear. So thank you for that. Adib, I'm going to ask you the same question. What do you want us to walk away with?
Hi, everyone. It's a pleasure to be here. I'm part of the panel. Again, Adib Fletcher, Senior Director for Latin America and the Caribbean and Humanitarian Response. So I wear a couple of hats within Project Hope. As you all know, we are a global health organization, but we also are quite involved in humanitarian response and more specifically complex humanitarian emergencies. I think, the discussion so far has been very, very interesting. I think when looking at main takeaways, especially when looking at my particular portfolio and the focus on, for example, refugee and IDP populations, and given the amount of work that I've done in this field for a long time, I think the main takeaways in terms of needs are across two areas in health. One is, restoring access to primary health care. This is something that's really, really important, especially for migrant populations. And second, reproductive health rights. If you think about the actual number of migrants currently outside or that have exited Venezuela into other countries in the region, you can estimate that 25% of those are within the reproductive health age. And so it's very, very critical to be able to provide services to that population, especially pregnant women who are not able to access those services within the Venezuela context. And all of that coupled with protection sector activities as well. We've talked about gender-based violence, violence against women and children. These are all very important considerations to keep in mind.
Yeah, I think you're right, Adib. And it was something that you reminded me of in some of our initial conversations, just how vulnerable women are. And then, of course, pregnant women, even more than that. So these vulnerable communities are just, they get at your heart because these are the folks that we need to be applying special attention to and care to, whether it is women, children, healthcare workers, especially people with special needs and people that are disabled, and not that pregnancy is a disability, I don't mean that at all, but making sure that all of these needs are being met, because someone who is pregnant, it's 2 lives instead of 1. And we just want to make sure that we're protecting them as much as possible. So thank you for that. I'm now going to transition into our individual panelist questions, and Facundo, you are up first. And I just want to kind of note that the migration crisis in Central and South America can feel like an entrenched issue that's been going on for decades. And we've even mentioned it here in our opening comments. But there's been a lot of fluidity within the refugee and the IDP populations over time. From a historical perspective, Facundo, can you talk about this evolution and what the picture looks like today, and really touch on, just to kind of set the stage for the other questions, what populations and scope are we talking about in this particular, these different points that we're discussing today?
Sure, absolutely. So from an historical perspective, it's important to know that migration has been important in the region for a long time. Latin America has experienced several migration waves, either due to economic reasons, such as the case of Ecuador, Venezuela, and before Peru, Paraguay, and Bolivia, and obviously due to violence, which have had an important impact in several countries of the region. Naturally, migrants from the region generally have tried to migrate towards countries with better economic opportunities. Spain, due to the similarity of languages, similar to Italy, and the United States, do a combination of economical opportunities and a support system given by the Latin diaspora. This has had a significant impact on the economy of the region even, which is mainly represented by the importance of remittances in several countries. In Central America, for instance, countries like Honduras or El Salvador has remittances representing around 21% of their GDP. And obviously we peak in Haiti, where almost 38% of their GDP is represented by remittances and therefore migration. So while migration between countries in the region was always present, in the recent years, we see an important increase, which naturally is exacerbated by the Venezuelan situation, which is around 6 million plus Venezuelans, which is about 1/5 of their population. As our keynote was noting, over 90% of these Venezuelan migrants are concentrated in 4 countries. But in addition to the migration of people from this region within the region, we also have migration from other parts too, such as especially Central Asia, India, Pakistan, Bangladesh, Nepal, and also Africa, such as especially Senegal and Ghana, which naturally try to migrate to countries with less visa requirements, such as Bolivia and Ecuador, and then start their journey towards the north. Naturally, these 4 humanitarian actors require some additional efforts due to cultural differences and obviously also language barriers. It is important to take into consideration that previous migrations has also turned into returnees. So people coming back to their respective countries in a very vulnerable situation. Obviously, this has become increasingly common during the COVID-19 pandemic, as livelihood opportunities in neighbor countries were affected, especially for informal work. There are several reasons for migration, naturally, and safety obviously is one of the bigger drivers of migration, but overall it seems that the lack of opportunities are the first reason for this. So in that regard, there's a lot of things that need to be addressed by humanitarian actors and development actors in order to address all these needs.
Yeah, there's a lot here. Not just, I think one of the big points that we want to make sure everyone kind of grasp is that it's the internal and external migration. So you have it all. And Facundo really reminded us of that. And I think it's a really great point, because you have all the complications from people coming outside of Latin America and spreading throughout Latin America. So we just kind of assume like, oh, language isn't an issue, or this or that isn't an issue. It is an issue. It is all an issue. And so this becomes a big part of the work that we should all be doing, is not making assumptions that everyone who is part of this migration crisis speaks a certain language, has a certain background, fits a certain mold. We have a lot of diversity, and even cultural diversity within Latin America is a really, and where people come from within there. So it's a really wonderful way to kind of look at this crisis. Is don't put people in a box. Don't just say this is the one thing that all migrants have. There's no possible way to do that, is what I'm hearing from you, Facundo. So thanks for bringing that up. Kendra, I am going to move over to you now. And Facundo really gave us a great overview of the current dynamics. So can you speak to the unique challenges as well as the specific vulnerabilities that migrating children within all of these populations that Facundo just pointed out are facing?
Yes, thanks for that. And just to complement a little bit on Facundo's presentation, Latin America is full of children on the move. You know, we talked about the 6 million who have left Venezuela. Well, we estimate about 1.1 of those are children who actually need assistance. So there are more children, but 1.1 million need assistance. Movement through the Darien has increased, and as Facundo mentioned, many of them come from different parts of the world, not only for Latin America, but about a quarter of them, about 22% of them, are children who are crossing through the Darien. And we're also finding movement that begins internally and then changes to external migration. We saw that a lot in Central America from the natural disasters of Eta Iota, where, you know, there was about 4.6 million people affected, but 1.7 million were children. And that displacement from the natural disasters, or also, as was mentioned, from violence, can be a trigger for that external migration or for crossing a border. But all these children on the move are not the same. There are very different characteristics of them. In recent years, there has been a change in who is migrating. When we were looking a couple of decades ago, we saw individuals, adolescents moving. Now we're seeing, particularly in Central America, a lot of whole families moving. So it's children within whole families, and that increases the number of children because it's the whole family as opposed to just the adolescents. There are different reasons that they're moving. Some are searching for income. Some are looking to meet up with other family members. Some could be traveling with their siblings in tow. They could be on their own or with their siblings. There could be young adolescents or young adolescent couples who have children. There could be adolescent, so child single moms who are traveling with their newborn. I mean, we've seen, you know, in Ecuador, you know, young, you know, 17-year-olds with their baby that cross the border walking. So some of these adolescents may have been victims of organized crime or other crimes such as gender-based violence or trafficking. And as I mentioned, some are traveling with their families, but some are also traveling with groups of adolescents. So the nature of that group, they're not a group of children. There's not unified. There are differences. And there are several factors that influence how children experience the movement, which can be as simple as how they traveled. By bus, they flew, had a boat, they walked, who they're with. Mentioned families, but they could also be with smugglers. They could also be on their own. They could be with friends. And then there's more complex issues that impact on that influence their experience. And that could be things that are complex issues such as their identity. What citizenship, what documents do they have? But also an identity, their gender identity or their sexual orientation, which affects how they are treated or what risks they may face on the road. The policy and legal context impacts not only on how a child can cross the border directly or whether they have to go through hidden paths or how they are received and if they can have access to services. We have found familiar needs of migrant children: shelter, water, health, nutrition, education, protection, and integration. But that's a list of what all children need. The difference is the migration context. What is education when you are not in one school, in one place for a year? What are protection risks in crossing the Darien or crossing via a non-recognized border? What additional protection risks can a child on their own in a country with a different language face? How do you provide psychosocial support if a person is in transit through a location for just a couple of days, distinct for being there for a period of time? How do you support reintegration of a child into their home country? So if they were returned to their home country, when they hadn't envisioned being in that place for their future in the first place. Children need vaccinations to protect them against diseases and access to healthcare services when they get sick. They need good nutrition. Their mothers need care during pregnancy and a safe place to give birth, and support for breastfeeding. In some countries, sexually transmitted diseases like syphilis are a major concern, and HIV as well, but also related to the gender-based violence that they may face on the way. Children and adolescents and adults as well living with HIV also need access to ongoing care and treatment. Sometimes if you don't have your identity, you're not able to access these services when you are in a different country, when you're in transit, when you are in your destination. How far these needs are being met varies considerably from country to country, by social group, and whether they have regular or irregular migration status. What is needed is that these rights are upheld by a supportive legal context and effective institutions. Back to you, Jody.
Oh, Kendra, that was a long list of really important and deep questions. It feels a little overwhelming. It feels like a lot, but it's really wonderful that we are asking those questions and looking at those topics collectively, and UNICEF, of course, is helping to lead those efforts in so many ways, because it is complex. It kind of goes back to what we mentioned earlier. There's not just one solution for these huge, big problems. There's so many nuances in each of them. And you mentioned a number of those. So it's complicated, and we keep saying it's complex, it's complicated. I think we could say that 100 times and it still wouldn't be enough. There really are so many differences between the different groups and their different needs. So yes, we're going to keep talking about some of these questions and hope to get to maybe not answers, because I'm not sure there are really clear defined answers, but there are efforts and collaborations that can lead us to a much better outcome. So thanks for bringing up the questions and pointing out all of these different kind of elements that make this whole process a challenge for each of us. Adib, I'm going to kind of turn it over to you now. So given Project Hope's presence in Venezuela and Colombia, and following up on Facundo's description of the unprecedented nature of the Venezuelan displacement crisis, what are the most pressing sectoral needs at the moment, just specific to the Venezuela migration in Colombia and neighboring countries?
Thanks, Jody. It's a very good question. I think that, as the other panelists have described, there's certainly many needs across the board. But Project Hope has perhaps a unique perspective, as do other organizations present here, in terms of looking at the crisis affected population inside Venezuela, as well as those that are outside, and primarily in the Colombia context for Project Hope. And I think there are, definitely parallels that can be drawn in terms of needs that certainly spill over as populations migrate into other countries in the region. But let me perhaps come back to Venezuela in particular in terms of sectoral needs. I think that within the health sector, the resumption of primary healthcare services has been essential and is essential. I think we all understand that the resumption of basic services is actually a precursor to better mental health, and it's one of the efforts that we have been putting forward inside the country. What does that mean in particular? As you know, given the crisis inside the country, there's been a pretty huge impact also on the economy. The government is not able to support basic services. That affects, physicians available at the primary healthcare service level. That affects medical commodities, which includes pharmaceuticals, medical supplies, and with all of these disruptions, obviously that kind of spurs that movement of population out to other countries seeking healthcare, as it's been pointed out earlier today. So inside Venezuela, especially around my area of expertise in the health sector, supporting primary healthcare centers with staff search support is important. Supporting the shipment of medical commodities into the country, or local procurement of these, so that they are available to the vulnerable population seeking care at these facilities is important. Everything surrounding what is called water, sanitation, and hygiene in health facilities is important, especially, as we have been dealing with the impact of COVID-19, anything related to infection prevention and control within these facilities is of utmost importance. And, at the same time, it has a trickling effect as these services are strengthened, right? Including reproductive health services. Then you by default create a lessening burden of utilization in other countries. I can't say it's significant at this point in time. Obviously, a lot of this is driven by resources that are available to organizations to do it, but it's certainly an angle that we have been exploring given our significant presence in Venezuela, as well as what we do in Colombia and Norte de Santander region, where again, based on the rules and regulations that the country has in place, especially Colombia has been very generous in terms of being able to provide emergency services to migrant populations, right? And that includes emergency pediatrics, emergency services for adults, and emergency obstetrics. One of the interesting points here, when you look at Norte de Santander in particular, Simón Bolívar Bridge and that entire area, I mean, that is basically the largest funnel through which, many Venezuelan migrants proceed into Colombia and then on to other countries. But it's really important to point out that the burden on utilization at regional hospitals is immense. And for the last 4 to 5 years, it's averaged around 70% burden on utilization on emergency obstetrics. For example, if you look at Erasmo Meos Regional Hospital in Norte de Santander in particular. So, these are all important considerations. And for us, really being able to focus on how we reduce that burden on utilization, especially in terms of health sector service provision, is really important. One of the other things that was pointed out by our keynote, emergency programming will always continue to be important. But one of the things that's being highlighted continuously by, for example, the government of Colombia, the Ministry of Health of Colombia, is that we need to start moving into development-oriented programming so that we can also start tackling the other needs, secondary, tertiary needs of migrant populations, and also for there to be an integrated approach and greater financing for the public institutions to be able to absorb that burden on utilization. I think, based on the latest figures that I saw, the government of Colombia has invested probably $160 million over the last few years in terms of services that directly benefit Venezuelan migrants in emergency departments. So that gives you an idea of the impact in Colombia alone, yeah? So these are some of the main points that I wanted to put forward, and it's back over to you, Jody.
Thanks, Adib. Yeah, I think you're bringing in this whole other element now, right? So we're talking about the political element, which is very tricky, the economic element, which is just in your face, that's everywhere, but especially, Venezuela and Colombia right now. And then the wash element, I mean, that's a whole new ball game, just keeping people with proper hygiene and water. So you're bringing up some really big topics that, again, we keep saying it's complex, but it's like a whole other level when you start bringing in how the political and economic elements relate to the medical elements. How do you get products someplace if the government doesn't want those products, or they're providing such stringent rules that it's very difficult to get those products in? And I know a lot of us struggle with that. There are people who have wanted to help out in Venezuela, for example, in a very profound way, but there are deep complications there. So thank you for bringing that to the fore. Reggie, I am going to ask you a question that I think, we talked a little bit about this already, these different sectoral needs. So many of the health settings that refugees and IDPs will encounter in the region are already under immense pressure. We talked a little bit about that. What approaches can be taken to not only help these stressed out health systems deliver appropriate care and services to that catchment population, but also meet the additional needs, some of which we've already talked about here, but especially of the vulnerable populations? And are there parallels that can be drawn in terms of health and then other related sectoral needs?
Thank you, Jody. It's interesting because our colleagues brought so many elements that I can mention and share in terms of my perspective. Adib described it very well, the needs of the healthcare systems and the essential work that the primary healthcare are placing on these situations. I believe that no country was prepared for the challenge that for the impact that the refugees, the displacement generate in those countries. So it's not just a challenge in terms of healthcare systems, as we said, it's a challenge for the economic, social, and political systems, because those people, those families need services, basic healthcare services, but they also need the schools for the children. They also need work to reestablish their autonomy and the way that they need to manage their families. So there are some definitely parallels that we can address between health and other areas. And one of the things that I believe that it's also important is that all the actions needs to be coordinated. It's important to have an organization in terms of which areas are being addressed in each of these countries and regions. My experience in Brazil, for instance, I saw the work that UNICEF was doing over there, not just in terms of healthcare, supporting the vaccines, immunization, and all the other areas in terms of healthcare, but also seeing the particularities and needs of the children and families in terms of education. Now, rights and education. And I saw with small schools inside of the areas of support offering something that those families need to receive. And the work around internalization and integration into the society are key elements for those populations. And we are not just talking about health, but sometimes the centers of health are the connections for those kind of activities, because the families are close those areas, receiving the assistance that they need, because sometimes they're traveling so many hours, they need to be assisted. But on those situations, we can address other aspects, such as the internalization, such as the work integration again, and identify which other areas. And we have, as organizations, we are supporting and working on this field. We need to work close. We need to have the collaboration among us. It's important to coordinate actions, to have an organization, as I said. We need to be close local authorities. We need to work with local protection groups and public other organizations. Otherwise, we will not have actions and response, sustainable actions. And for these situations. Another experience that I have in Colombia, and Adib was describing the situation over there. I visited Cucuta and other areas really affected by the migration, and the government took a long time to be organized and to have a strong and robust plan to support those populations. It's just not easy. As I said, no country was prepared for this. It's an immersive impact that they need to understand how to address everything. And the local communities are being affected as well, because sometimes in the specific areas, the local community doesn't have the same access of the migration population. So how to address everything? But if all organizations work close and in a collaboration aspect, we can identify each areas, we can work together with a plan that can be sustainable, supporting the healthcare systems, but also supporting other areas that needs to be offered for this population, such as education, work, and all the other aspects related for autonomy and integration in the society.
Yeah, that's really, you said the S word, sustainability. I think that's been something that's been a struggle, is how do you promote sustainability within a healthcare system when the needs of the population are very different and they're also constantly changing. And as we mentioned before, we're already weary, the community is weary, the healthcare system is weary. And so how do we provide something that is sustainable? Certainly collaboration is part of it. We have to have that. If we're going to make any progress, we have to have significant collaboration, which is why, of course, PQMD is hosting this. They are experts in collaboration. So it's a great forum that we have for this. I see some really great messages in the chats or questions. So please continue to add your questions as we move into the next round of questions. And then we will be transitioning after that into Q&A. So add those questions and we'll keep moving forward here. Facundo, I'm gonna come back to you. And we've discussed how this is a diverse population with diverse complex needs. I kind of just said that as Reggie did, and many of our other panel members have said that. So in addition, this is a dispersed population on the go. So they're often hidden, they're traveling in remote and hard to reach places. They're intentionally kind of often trying to kind of not be right there in the public eye. So how do you design a project that will not only meet their complex needs, but also be accessible to this really quickly moving population?
Well, that's a really good question. First, it's important to note that the process of migration in South America is, first of all, really fast, and second of all, continuously changing. So when we say fast, migrants want to reach a safe destination and are also often hoping to reunite with other family members. In the case of female migrants, we see that migration often takes place along with family and members who need care duties. And naturally, the priority in all of these cases is to try to ensure that the exposure to any risk or hazard is minimized, but making the trip as short as possible. Just to put an example, the trip between Colombia and Panama, the famous Daring Gap, which is about 80 km or so, where there has been countless incidents, is crossed in just a few days, 2 to 3 days. So this is an extremely fast pace for people who actually have appropriate hiking equipment and are trained for these kind of hikes. But naturally, the fact is that caminantes are not necessarily in this kind of shape and do not have the resources and are often in a very vulnerable situation, which makes this journey harder. It's obviously continuously changing. Routes will depend on climatic reasons, especially floods, for example, security, especially when we have armed groups, cartels, gangs, and obviously the movement of authorities, because some population wants to remain unseen, and we can understand why. But in addition to these changes, there are several stakeholders involved that we have little to no information from. As an example, last year, at some point, migration between Colombia and Ecuador changed significantly as migrants rely more on the service of coyotes, where they travel in motorized vehicles instead of walking. So obviously, all of our approach was waiting for people, for the caminantes, and was not necessarily what we encountered later. So this makes planning for interventions quite challenging. Humanitarian stakeholders have been trying to better adapt to these programs and to these changes, but this requires a bit of flexibility, not only from the implementing partners, but also from the donors and even from the local authorities, which we need to coordinate with. It is absolutely key that we mainstream gender on our approach to project design, specifically when we're talking about population in movement. 1 in 5 female refugees have been victims of sexual violence, which is extremely high. In addition, there's risks of kidnapping and abduction, which are 8 times higher on population in movement. So this is something that we need to take care of, need to consider it. And it's essential to also talk to females that have been in transit to see what their needs are in different stages, because we often focus on providing information that we think is going to be helpful for them, but it's not necessarily the case. A good example was at some point we were talking with families of migrant population and trying to reinforce the importance for them to take care of sexual violence and try to be as preventive as possible. And the first thing that says, like, yeah, we know. I mean, that's the first thing that the coyote will tell you. They will even recommend what's the name, like the contraception, because at some point the likelihood of somebody encountering sexual violence is extremely high. So that part they know. So we need to talk to them and see how we can support them to be, safer in different stages. How we can provide information in addition to what they need to provide assistance and life-saving support. Because otherwise we're always going to fall short on our project design. Mm-hmm.
Yeah, it's horrifying what's happening to women in particular. Also, let's just name it, it's children. Many of these are not what we would refer to as women by any sort of standards. And so it is just, it's horrifying. And to your point, with this constantly changing efforts, it's like you do something and then you kind of have to move to something else. And so the challenges really grow there. Thank you for pointing that out, Facundo. We're going to, just due to time, because we want to make sure that we are leaving enough time for Q&A, we're going to kind of move to another rapid fire. And I'm going to ask all of you this question, and Kendra, I'm going to ask you to go first. So there are many sectors of intervention that we've talked about here today, and probably some that we haven't, that provide necessary services to refugees and IDPs, whether it's health or WASH or gender-based violence, vulnerable populations. And there are many capable organizations that work within these spaces, including many that are here in this Zoom forum that we have. So understanding the proactive nature of our audience here, I'd love for you to quickly tell me one key gap that you think we can all plug into to further advance access and equity and health to these vulnerable migratory populations, whether those are funders or implementers. Kendra, what's that key gap that you think we should be plugging into?
Only one.
This is why time. I mean, I would love to spend another, 7 days with all of you to really dive into this. So unfortunately, instead of 7 days, we have 18 minutes.
I would think it's about the service providers, and really making that the service providers are able to recognize the women and children, screen the women and children, make sure that they can identify some of those. There's some common needs, and coming back to Reggie's point, we need to talk about not only the migrants and refugees, but also the host community. So we often talk about children affected by migration, which could be also those in the host community. So and some of those needs are common. Are there immunizations up to date? Screening for some of the diseases, such as sexually transmitted diseases mentioned earlier, or undernutrition, or the mental health conditions caused by violence, or caused by that list that Facundo just gave of all those horrors that could be faced in the migration journey. So how do we strengthen the capacities of those service providers to be able to deliver them sensitively, not only to their situation and whether they're hidden or not, but also considering what and I'm thinking about children, what the children's migration plan is. So what was their intention in their plan, because they have a plan.
Yes.
And how are these service providers in the health sector able to also respond to that plan?
That's great, Kendra. And that, I think, Reggie, I've seen a lot of head shaking when you talk about service providers. You're right in her wheelhouse. Do you have anything else to provide there, Reggie, to what Kendra just noted?
I echo what Kendra said about the services providers. And one thing is that they are part of the system. So they need to be prepared technically, but they need to be prepared emotionally to take care with this new scenario. All the healthcare workers, and I can say that I'm a nurse as well, so it is my background. And we are prepared to take care of all the needs of the population. But on these specific situations, change the scenario. And we need to help the healthcare workers to change their perspectives as well, to support and offer what those communities need under these situations, but also prepare to take care of them as well. Because we are talking about pressure, we are talking about high demand, different situations, different perspectives, different cultures, and they can feel just as a provider that needs to offer an assistance, because this is part of their responsibilities. We need to show them that there are lands for them as well, for what they need to assume the responsibility that they have as healthcare workers as well.
That's great. And Reggie always brings us back to mental health, which is just so important. I see everyone's head shaking with that. Adib, I'm giving you 1 minute. I don't know if you can do it, Adib, but I'm going to try. I'm going to force you to try to do 1 minute here.
I like to remain short and sweet. You know, all of these have been really good points. I think the main area of especially when looking at migrant populations, protection sector is incredibly important, and mental health and psychosocial support obviously falls within that realm. I think it's clear, and we can recognize that that is an immense need across the board, and something that we need to focus on, not only in terms of programming, but also in terms of advocacy with donors and implementers.
Yeah. Great point. We have to at some point bring in, right, the donors and implementers. So I think that's really great. We are going to transition now to the Q&A section. So Victoria, I think we're going to add Dr. Lopez back into the spotlight, and then we are going to have you answer or ask us some questions from the Q&A. And just keep in mind, everyone here, we are mindful that this ends at 12:30. I've got just a couple minutes to close, but I do think we have time for at least one question, hopefully two. So Victoria.
Great, thanks everybody. This has been a really wonderful discussion, and we have a bunch of great questions in the chat. So I'm going to start with one from Jackie Abbott, who I think anybody can take this. How are you combating donor fatigue? That is the opening question, and an easy one. I decided to launch you off with an easy one. So,
yeah, it's a great question. And certainly all of us in the NGO space here in particular, but I think too, it relates to corporates. We're feeling this. So Kendra, I don't know if you want to kind of take it, and then if anyone else wants to jump in to add on to something, and it looks like Dr. Lopez would like to speak as well. So Kendra, you want to go first, and then Dr. Lopez right after?
Sure, I'll try and be brief on it. I mean, but it's a very good question. I think all of us are facing it. I mean, I think one angle is that we're looking at is recognizing the different stages of migration and considering the communities of origin as well within that, which has also often been missed.
Yes.
So really to understand that whole process is one approach. The other approach that we're looking at is we're talking about children affected by migration, because many of the things that work for children are also within the host community too. So how do we look at that as a whole, like to be responding to migrants is also can be and refugees is also something that's supportive for the host community. It's not just sort of a separate thing. So I think that's another angle that we've been taking on it. And the third is looking at the relationships. And I think COVID in particular has recognized, you know, we're not individual sort of isolated units of these countries, right, where there's actually an effect, which is much broader. And so how do we take that sort of transnational or understand that impact of one area on another area? That's just to kick it off.
That's great. Dr. Lopez, we'd love to hear your thoughts.
Thank you. I think that I agree with everything what Kendra had just mentioned, and root causes, trying to look for root causes is key. However, from our side in UNHCR, at this point we are looking beyond donors
Oh,
for
beyond
humanitarian.
donors. Tell us more.
Yes, it's beyond donors for humanitarian response. You know, we are at this point when we see these situations here, and especially in Latin America, we are not talking about a crisis like a Ukraine, right? When really you need donors to be addressing immediately those needs. But in this area where we have those, some kind of a system that they can hold and take to the next step, inclusion and integration, I guess that they are the key, because where we wanted to go is more into the human rights approach. And we needed to start to rethink about, we really wanted to continue with donors for humanitarian actions in here, or we wanted to start to the nexus with development and to have a more like a long-term strategy and to take it from there.
Yeah, that's really great. Taking it to that long-term strategy. It's a really good philosophy. Victoria, I think we might have time for one, maybe two more.
Yeah, I think that
question.
what Dr. Lopez says feeds in really nicely to this next
Great.
question from Rebecca from IMC. She says, the panelists mentioned the importance of providing services to host communities while also serving refugees, IDPs, and migrants. What are some of the ways we can address the natural tension that exists between host communities and people on the move?
Whew, that's a really good question. Thanks for providing that. Adib, do you have comments on that? We haven't heard from you yet, and I see you laid back. I'm not going to let you just get off the hook there.
I think that's a great question from Rebecca, and it's a challenging one. Obviously, when looking at other humanitarian contexts, we know there can always be tension between host community and refugee populations or migrant populations. I think it's a little bit more clear cut when you look at health sector and access to health services, because for those organizations that are experienced within the humanitarian realm, obviously we cannot set aside or put aside host community when providing any level of services. So most organizations that are here today participating have this type of sort of universal policy about addressing the need of refugees or migrants and host communities. So I think from a health sector perspective, depending on the angles of intervention, it may be a little bit more clear cut. It becomes a lot more difficult, for example, depending on program modality, if you're looking at cash transfer programs, for example. And we can discuss various scenarios around this, but if a refugee population is receiving $500 a month and a particular country has entered a crisis, an economic crisis, where they themselves are not earning even, for example, $100 a month, you can see how those tensions can escalate. So those are major challenges around cash transfer programming. It's something that we face less in the health sector because we can be more equitable in terms of how we advocate with our donors and how we implement our programs.
Yeah, it's true. I see the challenges there being huge. Victoria, let's try to sneak in one more before closing comments, and maybe something that Facundo and Reggie might be able to comment on.
Okay, well, I was going to ask this question, Facundo and Reggie. Apologies if this isn't the one that you want me to pose to you. But this is from Lily from IHP. And just quickly, she's sort of saying the focus is on Ukraine right now in a lot of places. Are there any short-term or long-term lessons that you've learned from the years of working within this migrant crisis that we can apply to Ukraine?
Ooh, great question. I'm so happy Ukraine came up here because as mentioned, we are all significantly involved probably in Ukraine. So Facundo, do you have any thoughts on that, on how to kind of transition the migration that's happening that we've been talking about here in Latin America to kind of move over to Ukraine?
Well, it's a very complex question, really, because it's very context specific. It definitely depends on the action of several stakeholders and goes just beyond sometimes our power as people or even as humanitarian actors. I think something that definitely we should take into consideration, which is something that we have been struggling with all around the world, is trying to see the long-term planning on everything that involves population movement. This is very linked also with conflicts between host population and refugees and returnees, because naturally the impact and the consumption of resources will be extremely limited when the population increases from one day to the other in such a significant way. So I guess the best lesson learned that we have so far seen is that as long as we can see on the future, it is more likely that people will somehow be able to pool their own resources and like kind of integrate in society and then become a more productive member. So that's what I would recommend.
That's really helpful. Reggie, what are your thoughts?
As Facun said, depending of the country, depending of the situation, but what I can say is that we always need to understand the real and urgent needs of the area. So as we need to reassess it as an institution that it's offering sometimes grant for organizations to offer the support. It's important to have a transparent relationship to understand the needs and reassess every time. Reassess what we are doing, what we are trying to address, why we are doing, and which other actors are close to us, to understand when we need to change the route or when we need to leave, and what is the time of the government should take all the responsibility that they need on their situation. So we cannot be in a position that we will be there for a long term and sometimes for a medium term. So it's important to understand the real needs and the purpose, what we are doing and why we are doing, just to understand. But it's the right time as well to say, okay, until now I did what it was necessary, but for now we need to pass the responsibility for other organizations or the local actors or even the government. So reassess all the time what we are doing and which the organization. It's important to determine the plan that we will have for medium or long term.
That's great. Dr. Lopez, I'm going to give you 1 minute if you have anything that you would like to add as a final comment.
1 minute referring to that question?
Yes, that'd be great.
Well, I will say that again, is inclusion, integrations are the long-term solutions for those people. If we see, but how again, Europe, they have a different way of, and I mean, network have to support, and but however, they immediately what they are trying to do is not providing assistance just for the people to give it a tent and creating a refugee camp. They are trying to send them to the countries and to make sure that they have the paperwork for to be regular in the country, to get to the kids to the school, to get the work that they need for them to provide for themselves. So they are giving the autonomy for them to be able to be self-sustainable. So I think that this is the key, is integration and is the inclusion into the new country where we'll be hosting those people.
Great insights, Dr. Lopez. Thank you. So everyone, we have come to an end, sadly, to this fascinating 90 minutes. It's been an incredible session filled with insights and educational takeaways. So on behalf of the PQMD team and myself, I want to thank you, Dr. Lopez, for being here with us as a keynote speaker. To the audience, all of you, thank you so much for joining us today. I know that you found this really helpful and productive. And to our esteemed panelists, we are so grateful for your time and your perspectives that you have shared here today, as for the work that you do every single day on the ground in the field. It's exceptional, and each of you are extraordinary for spending your time and your passion doing this work. So thank you for being here and for everything that you do. It's really exciting that we're able to have these conversations, and we want the conversation to continue. So in the chat, it's mentioned that this recording will be in the PQMD community of practice. I really want to see some of these questions, continuing the discussion along these topics, which are super important. I also just want to take a second to thank the PQMD staff. None of this would happen without their work, and they are exceptional. And Victoria, especially, who helped to lead this event. I personally am so grateful to you for the way that you prepared me, but I think all of our panelists and our keynote would say the same thing, that without Victoria's help, we would be nothing. So thank you, Victoria. You're so incredibly such a valuable part of the PQMD team. So thank you. And we hope that you can join us for our next Global Health Policy Forum Roundtable, which is called Collaborating for Impact in the Middle East. And you're going to see it here. It'll be held next Tuesday, April 19th at the same exact time, 11 to 12:30 Eastern. And we're really excited about that. You can learn more about it and see it here, but we would love for all of you to attend. And we're planning for the return of an in-person Global Health Forum. Can we all clap to that? To be centered on issues. That is going to take place next April 24th through 27th in Paris, France. Come on, people. Nothing better than that. So excited that we'll all be together, hopefully in person in Paris this time next year. So thank you for joining us today. I think that we have done it. We may be 1 minute late, but that's great for me, especially. I think you guys all know. So thank you all. We're so grateful, and have a great week. See you next week.